Across the globe, you will meet women of various age groups with unique responsibilities that span across juggling work schedules, taking care of kids or not, families, while handling personal responsibilities. These things, coupled with nutrition and the unique hormonal structures, are some of the things that disposes women to certain nutrient deficiencies. So in this video, we're going to be talking about the various nutrient deficiencies that are most common with women and why this is so. Before we go into that, let's define what nutrient deficiency means. Nutrient deficiency, in simple terms, is the lack of nutrients and vitamins that the body needs to carry out various biological functions. This could lead to various short-term and long-term symptoms. Symptoms like headache, dizziness, hormonal imbalance, and a whole lot of them. So let's go over to these nutrients that women are mostly deficient in. The first one is iron. Research shows that women of reproductive age are most likely to come down with iron deficiency due to menstruation, especially when it's heavy, and for women that don't have enough of iron rich diets. Iron deficiency presents minor symptoms as initial stages but could actually lead to more severe symptoms. The second one is vitamin D. Use of sunscreens, limited exposure to midday sunlight, even lack of proper nutrition rich in vitamin D are what leads to this deficiency in women. The third one is magnesium. Magnesium is a very important nutrient and is strongly involved in about 300 enzymatic reactions in the body. It helps majorly with muscle relaxation, with stress, and easing of muscle cramps. Certain medication use like diuretics, stress, and poor nutrition can lead to magnesium deficiency in women. The next one is folate. Folate helps with red blood cell formation, helps prevent childbirth defects. Women of reproductive age are medically advised to start folate supplementation because this nutrient is needed. This helps to prevent unwanted effects that can result due to folate deficiency. The next nutrient deficiency most common in women is vitamin B12. Women who are 50 and above are the most predisposed to this deficiency due to the fact that B12 requires good level of stomach acid for proper absorption. Prolonged use of antacids and proton pump inhibitors like omeprazole tends to reduce stomach acid, thereby limiting vitamin B12 absorption. Also, medications like metformin interfere with vitamin B12 absorption in the body. The next nutrient is calcium. Calcium deficiency is also seen in women from 50 and above because it is assumed that from that age is when estrogen level drops very noticeably. And when estrogen level drops, it becomes harder for the bones to properly absorb calcium, and this could lead to a deficiency in calcium. So this is why women of this age are encouraged to take calcium rich foods or when necessary calcium supplements. The final one is iodine. Iodine is essential for thyroid hormone production. Iodine deficiency is usually as a result of poor intake of iodine rich foods and seafoods. Iodine deficiency can affect fertility, metabolism, and pregnancy. So, women who are pregnant or lactating are advised to have nutrition rich in iodine or consider iodine supplementation with their doctor. These are the most common nutrient deficiencies in women and the reason why women are mostly at risk of these deficiencies. If you're a woman and you start having unusual symptoms, headache, dizziness, you would want to consult your doctor for proper diagnosis and the right management for your condition.